I'm going to knock at my patient's door. Can I come in?
Yes.
Hi, my name is Darlene Rincon. I'm going to be your student nurse today. I'm going to perform an examination on you today, okay?
Perfect.
Okay, so can I see your name, I'm going to wash my hands first. 20 seconds per CDC guidelines. Put on my gloves. Can I see your hand? Perfect. What's your name and date of birth?
Wilson Rincon, 8/22/74.
Okay, and do you have any allergies?
No.
Okay, so I'm going to provide my patient with privacy, adjust the bed mechanics, make sure the bed rails are up to provide my patient with safety and to save my back as well. So then I'm going to go ahead and ask you a few questions. Is that okay?
Mm-hmm.
So who's the president today?
Yes, Biden.
And why are you here today?
I'm here for my eyes. I had a little stuff.
Okay, have you gotten checked out before for your sight?
Yes.
Are you on any medications or anything?
Yeah, I take the antibiotic.
Okay, and how long have you had it for?
Like 4 days.
Okay, so do you know what day it is today?
Mm-hmm.
What day is it?
Today is Thursday.
And do you know where you are?
Yes, at the hospital.
Okay, perfect. And who am I?
My nurse.
Okay, perfect. So my patient's oriented to explore. He's oriented to place, to time, event, and person. His vital signs I had already checked him previously. His respirations were 16 breaths per minute. His blood pressure was 120/80. His oxygen saturation was at a 98%, and he was breathing at 17 beats per minute. Okay, the mood of my patient seems normal. He doesn't seem down. Do you have any do you suffer from depression or any suicide thoughts? Are you safe at home? Okay, so my patient is not at suicide risk. His mood is normal, up to par. He is dressed currently to where he's at to get checked out. So, do you have any pain?
No.
Perfect. So he has no pain. If you were to have pain, I would go ahead and perform old card and ice. I'm gonna check your head, okay? So for your hair, okay, so no patches, no abnormalities, okay, no bulges. I don't feel any, lesions are not seen. He's cool to according to the climate in the room. No scars. I'm gonna check his ears. Do you have any pain?
No.
Any pain here?
No.
Okay, so they're symmetrical. So up and down. Okay, up and down. Up and back. Perfect. So patency, I'm going to check your nose. Okay, symmetrical. Your nostrils. Have you had any facial trauma?
No.
Okay, so patency, can you open your mouth for me? Oral mucosa is lubricated. Can you stick out your tongue for me? Side to side. Okay, and his teeth, can you smile? Smile. Smile. Okay, so perfect. His teeth are fine. No abnormalities. No. His lips are hydrated. Nothing out of ordinary. Everything was lubricated. So I'm gonna go ahead and check for his neck. Check his neck. Okay. Do you have any pain around your neck?
No.
So no abnormalities. No scars. No hyperpigmentation. So I'm gonna check for his thyroid. So I'm gonna push in to side, perfect. No JVD. And I'm gonna check for fluids of the artery. Okay. Perfect. So no bruits. And I'm gonna take those one at a time because if not, I could kill the patient. Okay, so everything seems good, no abnormalities. I'm gonna compare his later on his carotid artery to his apical pulse. Like I said, no JVD, so I'm gonna go ahead and test for cranial nerve number 1, which is the olfactory. So can you close your eyes for me, please? Can you smell this? You can smell it?
Yeah.
Perfect. So what was in there?
Is I drink the soda?
Yeah. Okay. So it was a carbonated drink. So then I already had performed this Snellen chart on him, which is for cranial nerve number 2. He tested a 20 out of 30, so he was standing 20 feet away from it. And it was checked on both eyes. So I'm going to check for Perla now, which is cranial nerve 3, 4, and 6. Okay, can you look straight for me? Okay. Perfect. So his pupils are equal, round, reactive to light, and accommodation. So I'm going to go ahead and now do the 6 points, which is going to test for cranial nerve 3, 4, and 6. Can you follow my pen, please? Okay, so I performed a star, which he followed perfectly fine. And that allows me to know that his cranial nerves there are just fine. I could have also performed an H, and that would have been just fine as well. So then now his facial nerves, which is going to be cranial nerve 5 and 7. Can you feel that?
Mm-hmm.
Feel that? Feel that?
Yeah.
Can you feel that? Okay, perfect. So he has his facial nerves for sensation just fine. So then I'm gonna ask you to close that ear for me. Close the ear, your ear. Tapat el oído. ABC.
ABC.
Okay, close that ear. ABC.
ABC.
Perfect. So he passed the whisper test, and I'm gonna have you stand up for me, please.
Oh.
And this is testing for his gait and his balance. So can you close your eyes for me, please? And stick your hands out. And he would stand there for 20 seconds. I would check his gait, if he's balancing correctly, if he's side to side, and so forth. And he's not. He has perfect gait. So then I'm going to go ahead and have you sit down for me, please. Okay. So then can you stick your tongue out for me, which I already had him do. Stick your tongue out for me, please. And this is move it from side to side. Perfect. So this is testing for cranial nerve 4, 5, and 7. Okay, so then now I'm gonna go ahead and put my hands on his trapezius muscle. Can you shrug your shoulders? Put them up for me. Perfect. So he has resistance. So that's for cranial nerve 11. And I already checked his gait and his balance. Everything was fine. So then I'm gonna have him. Can you do this with your hands, please? Your hands.
Oh, sure.
Like this. Okay. And can you do this from your heel to shin? Okay, so he has good upper cerebral and lower cerebral movements. Now I'm gonna move on to his chest. I'm gonna check for your chest, okay? I'm gonna put your shirt a little bit. I would do it on bare skin, but okay, so no signs of abnormalities, no lesions, no scar scenes. Check for his turgor. Okay, so he seems hydrated. Seems good. So then his thoracic cage looks symmetrical. He's breathing symmetrically. No barrel chest, no pigeon's chest. So everything looks just fine. And then I'm going to go ahead and check his breath and lung sounds while I'm at his chest. Can you breathe in now? Perfect. So I would let him do a full breath, but for time's sake. Okay. And I would always ask my patients to breathe in and out as I'm moving on. And since I'm checking his breath sounds, I will check the ones in his back as well. Okay, continue to breathe in and out for me. And I would be doing this on bare skin, but for the video's sake. Nor would I be sitting them. Okay, so since I'm here, I'm going to go ahead and check his back for any scars, lesions, abnormalities. Okay, thoracic spine, the spine. Perfect. So his back, it has no abnormalities, no scars, everything's symmetrical. So now I'm going to check his heart sounds. So with his apical, which I'm going to compare it to his carotid. Okay, and I would spend a whole minute. So his apical, his pulmonic, his carotid, pulmonic, his herbs, tricuspid, which is a little lower, and mitral. Perfect. And I would also be doing that on his bare skin if I was at actual study, so that it wouldn't interfere with what I'm actually hearing. Okay, so now I'm going to have you move your arms like this. So first testing his range of motion. And now since you're doing that, can you move your legs for me as well? For range of motion of his legs as well as lower extremities. Perfect. Now I'm going to go ahead and check his brachial pulse. Okay, his radial, just next to his thumb. I'm going to do it on both sides as well. Perfect. Thank you. And then I'm going to check his reflex for his tendons. Okay. Perfect setting, he would be laying his arm somewhere, or he wouldn't have to be holding his weights, but so his reflex are working perfectly fine. And then I'm going to go ahead and check for his capillary refill. Okay, so less than 3 seconds. And for resistance. Can you give me your hand? Okay, perfect. So he has resistance, so that's great. So then I'm going to go ahead and do his lower extremities. So his he wouldn't, have jeans on, so I can actually check his skin. But assuming he doesn't, he has no skin lesions, no abnormalities. Do you have any pain anywhere?
No.
Okay. His capillary refill. Okay, less than 3. Less than 3. I'm going to check his PDS pulse. His tibialis pulse on both sides. Okay, and up here. Perfect. Thank you. So then I'm going to check for his reflex there. Okay. So let's move forward perfectly. No edema signs, no abnormalities, no pitting, which is all a great sign. And then I'm going to go ahead and check your abdomen, so you can lay down for me, please. Perfect. So I'm going to check all 4 quadrants, starting from the right upper quadrant. I would check all 4 quadrants for a minute. If any abnormalities, I would check it for 5 minutes. I'm going to put your shirt up. Perfect. So I'm going to go ahead and auscultate. What's the consistency of your bowel sounds?
It's normal.
Normal? So not runny, no diarrhea?
No.
Perfect. How many times a day do you go?
1 time.
1 time a day? Okay, good. Do you have any UTIs, any urinary diseases or anything?
No.
Have you had any? I'm going to go ahead and now, because if you had an abdomen or a quadrant that was in pain, I would leave that one for last and palpate. I would leave that one for last because they're more sensitive there and I don't want to dislodge anything. Okay, so perfect. And I obviously had it already inspected, no abnormalities, everything seems symmetrical. So no scars. Oh, I forgot to check for his bruits on his abdominal arteries. Okay. Alright, so no bruits, so perfect. You can sit up if you'd like. So now that I'm done with the patient, thank you for everything. I'm going to be calling your physician for you. I'm going to go ahead and perform high hygiene again, make sure that my patient's bed is good for his safety, and place to call it. If you need anything, you can go ahead and call me.